Food isn't always medicine. Debunking the myths. People on TikTok say celery juice cures autoimmune disease. Influencers claim, eat this and never need meds. That's dangerous, and it's often wrong. Today I'll show you what food can do, what it can't, and how to spot the scams. Food does not always equal medicine. Let's separate truth from hype. We'll cover, first, where food does act like medicine. Second, common viral myths and why they're wrong. And third, practical evidence-based actions you can actually use. No fluff. Real science, plain talk. First, knob this down. Food is medicine isn't a slogan that magically replaces doctors. It's a public health approach, using diet to prevent or help manage diet-responsive conditions. Some programs even prescribe healthy food as part of treatment. But that's not the same as swapping insulin for kale. Programs like this work when paired with clinical care and access, not when someone posts a 30-second miracle cure. Heart disease and Mediterranean diet. The strongest large trial evidence, a Mediterranean-style diet, plenty of vegetables, olive oil, nuts, fish, reduced major cardiovascular events in a randomized trial. That's not a fad. That's high-quality evidence. For heart risk reduction, diet patterns matter, and the Mediterranean pattern has the best RCT data. Blood pressure and the DASH diet. High blood pressure responds reliably to dietary pattern changes. The DASH diet lowered blood pressure in controlled trials. That's why clinicians recommend it for hypertension management. Cholesterol and soluble fiber such as oats, beans, and psyllium, lowers LDL cholesterol a bit. It helps, but it's not always enough to replace medication for people with high risk. The effect is real but modest, useful as part of an overall plan. Myth 1. Celery juice cures autoimmune disease. No. There are no clinical trials proving celery juice heals autoimmune diseases. Drinking celery is fine for hydration and vitamins, but not a cure. These claims come from non-medical sources and lack evidence. Myth 2. One superfood will fix your organ. Blueberries may support some aspects of cognitive performance in some studies, but they're not a single food miracle. Evidence shows small cognitive benefits in trials, not brain immortality. Myth 3. Herbal supplements equal harmless medicine, the narrator cautioned. Supplements like turmeric and curcumin have some positive trial data for certain conditions, but quality and dosing vary, and high doses can cause harm, including liver injury in rare cases. Herbal supplements are drugs in disguise. Myth 4. If it's natural, it can't interact with meds. That's naive. Many natural compounds interact. With prescription meds, for example, some supplements alter how the liver processes drugs. Always check with a clinician. Practical organ-by-organ guidance with evidence and clear actions. Heart. Follow a Mediterranean pattern. Plant foods, fish, olive oil, nuts. It lowers cardiac events when adopted as a pattern, not by gulping one miracle food. Blood pressure. Use DASH plus reduce sodium. The DASH diet reduces blood pressure. Cut highly processed, salty foods. Increase fruits, veggies, low-fat dairy, and whole grains. Cholesterol. Add soluble fiber, but know its limits. Increase oats, beans, psyllium. It helps lower LDL modestly. If your LDL is high or you have heart disease, diet alone may not be enough. Medicines may be needed. Diabetes. Medical nutrition therapy plus clinical care. For type 2 diabetes, nutrition therapy is central, but guidelines stress individualized medical care. Diet helps control blood sugar, but medications should only be replaced under clinician supervision. How to evaluate a food cure claim, your checklist. Look for RCTs. Single studies or anecdotes aren't proof. Check sources. Is the claim from a peer-reviewed journal or a social post? Dose and quality. Supplement trials often use high, purified doses. You can't duplicate that with a spice jar. Safety first. Check interactions and side effects. Clinical context. Does it require medical supervision? For example, diabetes or heart disease. Common objections and honest answers. But I heard fasting, celery, or probiotic cured X. Maybe correlations exist. Causation does not. The responsible path is to try evidence-based, low-risk lifestyle changes and consult your clinician before ditching a prescription. Takeaway and practical mini-plan. If you want to use food like medicine, first, adopt a proven dietary pattern such as the Mediterranean or DASH diet. Second, add clinically useful steps like soluble fiber, reducing sodium and whole foods. Third, treat supplements like medicine. And fourth, always work with a clinician for serious conditions. Remember, small, consistent changes beat flashy fads. Call to action. If you learned even one thing that'll keep you or your family safer, like not trusting a social post with your meds, hit like, subscribe, and share. If you want a breakdown of one myth, whether it's celery juice, turmeric, or blueberry, tell me in the comments and I'll make a follow-up deep dive with sources. Imagine this. You're in a quiet garden, surrounded by the scents of fresh herbs and the rustle of leaves. This is where true health begins. Not in 30-second fixes, but in lifelong habits. Consider your next meal colorful, diverse, and whole. Let each meal be a step towards better health, not a detour. Let your choices stem from knowledge and balance, not from fleeting trends. Join a community. Learn from verified sources. Share your knowledge. As you improve your health, inspire others to do the same. Together, let's create a shift from misinformation to mindful living. For more details, like, share, comment, and subscribe, MAFHH Roots, and follow on Facebook, Kusain Ali.